Moving on to Therapeutic Thursday. So we have actually compiled a list of thoughts, questions, suggestions, any kind of items that you might need in preparation for surgery or after open heart surgery. This is all from the experiences of your community members, written by the community, meant to help enhance the community. So let's check out this list here because it's pretty extensive and it's pretty interesting. So let's click on this list. Okay, so it's strongly suggested that you have a loved one with you during your consultation or your pre-op. In addition, I would say, and I'm sure it's listed down here somewhere in your post-op, because you need an extra set of ears. As a patient, you're all verklempt, you've got all the nerves and the feelings going on, and you're probably going to miss something or misunderstand something. Better to have another set of ears taking notes for you that you can review later. And another person cares about you, so they may have their own set of questions you never even thought of. So that's important. But making that list of questions that you actually want to discuss before you go, that's even more important. And so some of the questions you might want to ask would be, how many hours do they think surgery will last? How long will you be in the hospital? What exactly is the procedure you're having? What are the risks? What can you expect when you wake up? How is the pain medication being handled? Will you wake up with wires, catheters, IVs, breathing tubes? I know that's a big one for the community. Everybody's concerned that they're going to wake up on a breathing machine. And I would say most people are awake at the time that they're going to take it. They have to take you out of sedation, but most people don't remember it. And if they do, they remember it like a dream. So that's not everybody, but that's most people. But these are all such great questions. You can ask them of the community members, but remember, everybody's different. But you should definitely talk to your doctor about this. Can someone spend the night? This is crazy because we know that we've seen this change. We saw it before COVID. It was very different during COVID, and it's still kind of funky and a little different afterwards. So find out at your medical institution if you can have someone actually spend the night. Now, if you're someone that tends to become anxious, like really anxious, talk this over with your doctor ahead of time, because sometimes they can give you a medication you can take at home before you even arrive at the hospital, just to kind of like take the edge off. I mean, we know that you're not supposed to have anything to eat or drink before surgery, but maybe they'll be willing to give you a little something so that you're not so amped up and walking in with an astronomical blood pressure and an extremely high heart rate. That doesn't really help anybody. Okay, we've already talked about seeing if a family member can stay in the hospital. Here's some great things to pack. Don't pack a lot, because it's just more stuff that you have to take home with you. And you're not going to get flowers in ICU. You're not going to get all kinds of stuff if you're still in that floor. That won't happen until you go down to a step down unit, if you go down to one. And I say if because I was discharged right from the ICU, which usually doesn't happen. So sometimes that does happen to people, although not often. So someone suggested pack silk pajamas. I don't know that I agree with that. I wouldn't want to get any schmutz on my silk pajamas. I think that once you're in your hospital gown, you're going to want to stay in the hospital gown for a while. I mean, you might want to eventually go to your own pajamas, but you want things that are going to be open and easy to put on and take off, and something that's going to be soft on your skin if you're even feeling like you just want to change out of what's provided for you. Slippers or socks, whatever you choose, you need them to be treaded. Some people don't like the socks that the hospital gives you, and I completely get that. I know that Target and Old Navy, depending on the time of the year, they tend to sell socks that are really super cute, whether it's superheroes or animals, but they've got the treading on the bottom because the last thing you need is to slip. I probably wouldn't recommend slippers because they could slip on and off your feet unless they're putting them on like a shoe. I wouldn't do anything that you just slip your foot into. I would rather see people wearing treaded socks before that, but that's a personal preference. Women, we get this question all the time. What kind of bra am I supposed to wear? Don't worry about it. A lot of hospitals, when you wake up, you're in a bra. You went to sleep for surgery without a bra, and then you wake up and you're in a bra. And I know in my hospital, when I woke up, it was a front closure bra. I don't even think I took it off the whole week I was there. And then I bought two more to bring home because it was so incredibly comfortable to sleep and have that kind of support. The first time I tried to sleep without one, let's just say, wasn't very comfortable. But not every hospital, I have learned, does this. So this is a good question to talk to your doctor. Does your hospital provide that? You definitely don't want a sports bra because that requires you to put your arms over your head and try to pull that down. That's going to be very challenging and difficult, especially if you're going to have a scar. So, and stitches. I would just talk to the hospital, see if they've got something that's front closure or have somebody help you with something that's back closure because you may really want the support. Okay. A lot of people that are into aromatherapy will probably agree with this statement. We know that essential oils like lavender and chamomile, rose, frankincense, they reduce stress. This has been proven. We just know it. And it actually helps reduce anxiety and promote relaxation. That's why when you're at a spa, you smell lavender, you smell these smells because they help you relax. Some hospitals will actually give you essential oils when you're in the hospital. But I would ask if you can bring it in because people become very sensitive to smells as well. So talk to your doctor if it's allowed and that's something that you're really into, bring it. Bring it with you if they say yes. Okay. Pack toiletries. That's personal preference. They're going to probably give you a toothbrush, toothpaste, a razor, a shower gel, some kind of dry shampoo or a shampoo conditioner product, something like that. If you would prefer to have your stuff with you for when you do your sponge bath, then bring the trial size samples because you don't want to have to bring a lot of stuff back and forth from the hospital. If you really want to shave and you really want to bring your razor and some shaving creams, totally up to you. I bet you if you ask, they have it there, but who knows how much these hospitals charge for a razor or shaving cream. So you're probably better off bringing it from home. Trial size though, bring the small ones with you. Here is one that's very important. Cell phone and charger. If you like to stay connected to the world and you want to keep your friends and family up to date on how you're feeling, then bring your cell phone and bring your charger. They'll have it already plugged in waiting for you when you arrive in your room. Don't worry about an iPad. Don't worry about thinking you're going to finish reading your favorite book. You're not going to have any energy for any of that kind of stuff. You're not even going to care about the TV. Just bring the absolute essentials. And again, whatever you bring to the hospital, you're going to have to bring home. So try not to overdo it. There's nothing that's going to be like this is a relaxing vacation. This is hard work for you as a patient and hard work for your caregiver. Accept visitors. If the hospital lets you have visitors, we strongly recommend you consider accepting a visitor. Of course, make sure that visitor, common sense, make sure they don't come to see you and they're sick. That's the last thing in the world that you need. Accept them when you're ready. Say no if you're not. It's very simple, but having that positive energy of people that care about you can really aid in your recovery. Don't try to tough it out. If you're in pain, tell the doctor. Don't turn away pain medication if you're in pain and you're able to take pain medication. We understand and respect some people that are not taking pain medication due to some prior addiction issues, but if you can, don't turn it away. You don't want to be chasing pain. So, and if you're in too much pain, then you're not going to be able to do a good job of walking, of sitting in chairs, and doing what you can do to move you through that process to be discharged. Now, you might have a PCA, which is a patient controlled analgesia, or like a button, and it gives you pain meds, right? You might want to push it all the time. Just know that that doesn't give you pain meds all the time. Just because you push it 5 times in a row doesn't mean you got pain meds 5 times in a row. It's very safe. It's only going to give you pain meds at appropriate intervals and the appropriate dosing. So feel comfortable, push the button. If it's not time, you're not going to get anything. And then you need to really tell somebody and have them handle any breakthrough pain. If you're not given a PCA, then don't hesitate using that call bell. Talk to your nurse. See, in the ICU, it's like a 2 patient to 1 nurse ratio. So it's a lot of personal attention and you don't want to be chasing pain. So just make sure to tell somebody that you're uncomfortable. Okay, get up. When the doctor says it's time to sit up, get up. When the doctor says it's time to move, move. When the doctor says you can now walk, walk. It gets all of your gases moving, your intestines moving. It gets things flowing, your blood flow. It's good for you. As soon as your doctor says you can do it, like we always talk about on Movement for Movement Mondays, you need to do it. So rest is important too. So take as much of that as you can as well. Tell people to leave, make it quiet. Hey, if you want an eye mask or earplugs because the sounds and the people coming in, the nursing staff, it's too much, You can have somebody get that for you. Some hospitals offer that as well. Okay. Someone suggested that you ask somebody to take a picture of you when you're in the hospital. So, this is a little controversial. As somebody who had an aortic dissection, my husband took a total of 3 pictures of me. He took one of me at the first hospital I went to once we found out it was a dissection. And I think he probably did it maybe because he thought I wasn't going to survive. So he took one of me. It's not pleasant. I'm in pain. Then he took one of me right when the breathing tube was taken out. Also not pleasant. I don't even know who that is that's in that bed. I don't remember much about it. But then he took one of me when everything was removed. My hair had been washed. It was in a little bun. I still don't remember that either. But what I think that did is it showed me progression. It showed me that I was getting better. Even in that first week, I saw what I did look like to 3 days later what I looked like. And it was a complete difference. And it's important. I go back 8 years later and I look at these pictures and I just think, God, I can't believe that was me. And I look at where I am now. So sometimes it's very hard to see that you're progressing when you're in recovery, and maybe pictures, maybe that's something that's going to do it for you to help you. Um, Even if you don't want to view it when the picture's taken, you want to view it later, and then do it. If it's not something that works for you, you don't ever have to look, right? It's just really a personal choice. Excuse me. Ask somebody to be your personal advocate in making updates for you. If you're into Facebook or Instagram or whatever, have a friend do it, because your other friends and family members are going to be nervous. You don't want a million texts coming in. You don't want a billion phone calls coming in. Let somebody else update people for you. You can also use the website called caringbridge.org. You can set that up before your surgery, give some background about the surgery. You can even direct people to make donations to your favorite charity in honor of what you're going through, and provide all your updates there for you. So it's a one-stop shop. People can be sent to that website, to your own personal page through caringbridge.org, and get a complete picture of where you are in your recovery. Some person suggested ask family members to bring cards, to bring books, to bring games, whatever. It's really mainly for them, because your surgery is going to could take 5 hours, could take 12 hours. You never know. Then there's the whole waking up process. And then there's so many hours spent in your room when you're, as a patient, sleeping on and off. So it kind of helps the time pass a little bit while you're in the hospital. Ask questions about your surgery while you're in recovery in the hospital. You're going to get a lot of information to go home with you. And if you can remember and you are questioning anything, ask it. You might not even remember why you're in the hospital. Okay. And open heart surgery can be very taxing, not only on the body, but also in your mind. And you might find yourself asking the same questions over and over again. And that is okay. That is very, very normal. If you have questions about medications you're taking, like what is that drug you're giving me, ask it. And if you just asked it 5 minutes before, it's okay. It's okay. Doesn't mean that anything's wrong with you mentally. It's pretty standard and normal. So is crying. Crying is very normal. We hear that the male population tend to cry and have a lot more emotions than the female population. I'm not really quite sure why they tend to get the blues more, but they do. It's open heart surgery has caused depression short term. We're not sure if it's just the anesthesia. I don't know. I'm not a doctor, but regardless, if you have crying spells because you saw a puppy, or because you saw a Hallmark commercial, or because someone brought you a popsicle and you're just so happy you cry, let it out. They say that tears and crying is a way of healing anything that's going on in your mind emotionally. So just let it out. It's totally okay and normal. Okay, here's a strange but tried and true tip. This one came from me. All right, peppermint. Peppermint, whether it's from a mint or from toothpaste, it's essential to bring with you to the hospital. And here's why. When you have a catheterization to prevent you from having to urinate or use the bathroom, a lot of times when they take that catheter out, it takes some time for everything to turn back on and for you to be able to use the bathroom on your own. This occurs in women that have C-sections, or it can occur if you have any kind of surgery where you've been cathed, basically. And after a certain period of time, if you don't urinate, they're going to cath you again. So one time a nurse, after I had my son with a C-section and I had to go to the bathroom really badly, but it wouldn't come out, she came over and dropped a couple drops of peppermint oil in the toilet bowl. So I could smell this peppermint oil. And don't you know, I went right to the bathroom. There's something in the essential oil of peppermint that creates relaxation. It could just be that it distracts your mind into thinking, oh, I'm smelling peppermint. And next thing you know, you're going to the bathroom. I don't care why it happened. I just know that I take peppermint with me for every surgery, and I've had about 15 of them. So it comes with me every time I have to go because I don't want to ever be recast. So I know it's worked for other people before that's had prostate surgery. They had brought peppermint with them, and it also aided in their situation. So I know that it works. I don't know that it works for everyone, but I know it's worked for some people. So just a suggestion. All right, here are some others. Another one, potassium. If your potassium gets low and you need to be supplemented while you're in the hospital, the fastest, easiest way is going to be through an IV. But let me warn you, potassium in an IV feels like the devil's hell acid being put into your IV tube. There's no two ways about it. It burns. And if it's being pushed fast, it's going to hurt really badly. It just does. Every nurse knows this and doctors know this. So they should be pushing it slowly, mixed with saline so that it's tolerable. If it is not tolerable for you, push that button right away because you have options. You can take a potassium via pill. It's a salty horse-sized pill, or they have it in liquid. It's disgusting, but it does the trick. Discuss this with your provider ahead of time. Have a plan on how you would like to receive potassium if that should go down and become low. I'm telling you, don't say I didn't warn you. There's just certain things that just hurt in the IV, and I don't know anyone that it hasn't hurt. So have that plan. Think about that a little bit and talk to your doctor. For all I know, they've changed the makeup and the doctors now say potassium doesn't hurt. But I know I will never forget for me that it did hurt. Just saying. Okay. Nurses are incredible. They're amazing. But as with friends, as with people in general, we don't always necessarily mesh with everybody in our life. So there's a chance you might not mesh or connect with who is assigned to you as a nurse. That is okay. This person is providing you care. If you feel as though there's a connection that's off, communication style that's not working, don't just take it. Ask for the charge nurse and ask the charge nurse to change out a rotation of who's scheduled for your room in your care. That is perfectly acceptable and perfectly okay. I can't imagine a time where a charge nurse would say, no, you have to have Nurse Ratchet. It's just the way it's going to be. I'm pretty confident that they would accommodate your request. If it becomes a significant problem, you can go above the charge nurse if you need to. But typically, if you ask the charge nurse, they'll make your suggestion become a reality. Okay, find out hopefully ahead of time, if your physician is going to try to prescribe cardiac rehab or not. I don't know your particular case, but I know that we've heard from community members that if they are told that they should have cardiac rehab, that insurance companies here in the States are just amazing that they don't necessarily want to grant it to you, especially if you had your valve resuspended. For whatever reason, they don't want to grant it to you. So if you're unable to have cardiac rehab for whatever reason, you have the option of asking to go to physical therapy. So between physical therapy and cardiac rehab, both can help you with posture, stamina, breathing techniques, just feeling confident about your situation as you start going through your recovery and management. So physical therapy, when it's approved, and it's usually always approved, will help you with stress because it's going to teach you how to have control over your breathing, diaphragmatic breathing, and your posture, because you really can't sit necessarily upright and straight after having your sternum operated on. You definitely can't really twist. Getting out of bed is a whole process, etc. When you meet with cardiac rehab, it's very different because you're going to be on an EKG monitored during your exercising. Both locations, however, can take blood pressure readings before, during, and after, as well as your heart rate, and they will report those back to your doctor. So in addition, some survivors complain about having shoulder pain, sore shoulders after, and that a lot of that is positioning during surgery. So that can happen, and PT is great for that as well. Just working out any potential scar tissue that forms around incisions. That also happens during PT. So there's definitely some nuances and differences to consider. And of course, you want to talk with your own PT that you've established and your doctor and make sure that this is how they operate in their practice. Okay, we're winding down these suggestions here. Mental health, as described earlier, you might feel the blues. It happens. It's just something that definitely happens. So, having some general depression after surgery, it's very, very normal. While it might be normal, there may be occasions, though, where you might have to have it addressed, such as if you feel you might have post traumatic stress. And that can happen with an emergency dissection or an emergency surgery. That's also pretty normal from what we're hearing at this point. That happens fairly often. So your brain can really become very effective from major traumatic events or just major surgical events or health events. And this can happen to your caregivers as well. So you should never hesitate in reaching out to a licensed clinical social worker. They can really help you process your emotions in a variety of ways and kind of help you work through the confusion of what's just happened to you. We, as an organization, Aortic, we also offer many virtual support group meetings. And what really sets us out from anyone else is, number one, we are doing them virtually twice a month for anyone, twice a month for caregivers, and once every other month for those that are grieving the loss of a loved one after they've had surgery or whatever the case may be. But our support groups are facilitated and moderated by patients, by caregivers. So we kind of know what you're feeling. We kind of know what a chest tube feels like to come out. We kind of know what it's like to sit and wait for our loved one's surgery to end. We thought it would be 5 hours, now it's 7. We know these feelings and emotions. So we talk the talk, we walk the walk, and it kind of makes the situation a little bit easier when you're in a support group like that with people who are firsthand, can understand what you're going through. So this is an extensive list. It's a lot to go through. It's a lot of great information to think about. If you think you're going to be having surgery, you can think about some of these things before or after. So that's your Therapeutic Thursday and pre and post surgical suggestions. Or maybe, yeah, I think that was it. Part of our Thursday.
And you're out.